All right, let's talk about some of the new treatments that are coming down the pike in prostate cancer. The time-honored treatment for prostate cancer has been we call radical prostatectomy, and that's removing the prostate. That actually dates back to the early 1900s. And then radiation was introduced to treat prostate cancer decades later. And both of these techniques have been refined a lot, radiation and surgery. What else is there? Freezing, cryotherapy. That's been around for a long time to treat cancers. You use it to treat skin cancers. And what people used to do is deliver liquid nitrogen through tubes to the prostate, and you could freeze it. That was kind of really early treatments with a lot of side effects and kind of barbaric in a way. And now what you can do is you can put in small probes, the size of soda straws or smaller than that actually, big needles, and you can circulate argon gas through it. And then when the gas expands, the Venturi principle, through an opening, it freezes. And you can get down to -70, -80 centigrade. And if you get down to -40 or -20 twice, you can kill almost any cell, basically. And so it's just a matter of putting these probes in the prostate, monitoring them, and using ultrasound to look at it. Works very well. It's outpatient. It's simple. And you can also have heaters too, so you can protect nerves by putting helium through these. And helium, when it expands, it heats. So we got coolers and heaters. And that's actually a good way to treat a lot of prostate cancers in men that have failed radiation. It just hasn't caught on in the United States. There was a lot of controversy early on with it. Another new exciting way is to use a high-intensity focused ultrasound. And so if you take a magnifying lens and you hook it up, look at the sun and a piece of paper, you burn a hole. So if you focus ultrasound in the prostate, you can do the same thing. And you do it through transrectally. You just go through and you just kind of paint the prostate, starting up at the top. The limitations are size of the prostate. You can't do big prostates and so forth. And you can damage the urethra and that. So there are studies ongoing with that. There's ways to actually produce electricity in the prostate, and ablated is called electroporation. And that's some exciting things. So there's a whole bunch of other things out there besides surgery and radiation that are coming down the pike.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.